Good morning, everyone, and respected chairpersons. And I would be talking about normal breast development and disorders in adolescents. So, breast development basically begins at the 5th week of embryonic life and originates from ectoderm and mesenchyme. We know all about it. Milky lines appear in 6th week of embryonic life, then 10th week fetal week atrophy of the proximal and distal part of milk line occurs. Development of areola and 15 to 20 solid cords occur in 5th fetal month, while breast nipples appear in 8th fetal month. Later in childhood and puberty, under the influence of steroid hormones, estrogen and progesterone, the breast buds enlarge and glandular elements appear. So, puberty is a time of rapid and complex changes involving overlapping components, hormonal, physical, and cognitive. In adolescence, tissue and ducts grow in response to estrogen, while progesterone induces lobular growth and alveolar budding. Breast development in adolescence is described according to a very important the Tanner's stage, and once we know about this Tanner's stage, we will know what is normal and what is abnormal. Thelarchy is the onset of secondary breast development in adolescence and occurs between 8 and 13 years of age and often represents the beginning of the puberty. Breast development is completed between 2 and 4 years after thelarchy. So what is this Tanner's staging? Tanner's staging is an objective classification system that providers use to document and track the development and sequence of secondary sex characteristics of children during puberty. It was developed by Marshall and Tanner while conducting a longitudinal study during 1940s to 1960s in England. Clinical examples of its use include delivering timely anticipatory guidance on subjects like menstrual hygiene. Now, what happens, how do we take this scale is that stage 1, no glandular breast tissue. Stage 2, breast bud palpable under areola. Stage 3, breast tissue palpable outside areola and no areolar development. We can see in this diagram much clearly that how this elevation of then what is the breast bud stage, then enlargement of breast and areola and projection of areola and papilla and recession of the areola to the contour of the breast and projection of papilla only. This is in relation with other sexual characters like pubic hair description and happens both in male and female. Now that was the normal development. What happens with the abnormal breast development and other breast problems? Now, first of all, we will take upon the congenital breast abnormalities. Accessory breast is often located in axilla lines influenced by estrogen and progesterone, and we as gynecologists see this condition very, very frequently. And people are our patients are quite worried about it. They think that this is a cancerous growth. This is an asymptomatic mass sometimes seen during pregnancy, and treatment is just counseling, but one should be very clear that it is there. If it develops infection or increases in size, it may need surgery. Now, polythelia occurs in about 1% of women. A supernumerary nipple grows along the milky line and can be visible at the birth, or polythelia may be associated with congenital abnormalities in the urinary tract as well. Surgeries may be considered for aesthetic reasons. Amastia or athelia. Amastia is the complete lack of breast tissues, where athelia is the absence of nipples. These situations are due to a developmental failure of total disappearance of the milky lines. Surgical treatment with breast augmentation may be indicated in these situations, but we should be very clear in mind that in adolescence, till the development of the breast is wholly done, then only we can advise them for surgery for aesthetic reasons. Now, disorders of the nipples, inverted nipples, it is benign, often familial condition. This is normal variation of normal shape, and for a teenager who has not completed breast development yet, cosmetic surgery should be refrained from until breast development is complete. As an abnormal finding, when it did not exist from birth, it may indicate inflammation or even malignancy. Now, breast asymmetry. Breast asymmetry is common finding in about 25% of adult women, a common cause for body image issues in adolescents. We see a lot of adolescents, bothered about this. मेरा एक breast छोटा है, एक breast बड़ा है, एक ऊपर है, एक नीचे है. So both of them, they need lot of counseling till their whole breast is developed. Even the woman beyond the age of maybe 18 years, this may stay there. Teenage patients should be reassured and informed that their breast development is not yet complete. This is a take-home message. Breast atrophy and hypoplasia. Bilateral breast hypoplasia is due to either decreased estrogen secretion or inability of target tissue or to respond to the circulating estrogens. Possible causes of breast hypoplasia include gonadal dysgenesis in the context of Turner syndrome, various tumors producing androgens, pre-adolescent hypothyroidism, and pituitary hypogonadism. Unilateral hypoplasia has been described in association with Poland syndrome and anterior thoracic hypoplasia. Another entity is breast atrophy. Breast atrophy is usually acquired and is due to significant weight loss, resulting in significant loss of adipose tissue of the breast. Causes of breast atrophy can be anorexia nervosa, weight loss because of chronic illness. I have seen one patient who was an athlete and she was in vigorous exercise. Her breast was not, increasing in size at all. And she even had no periods for a long time. Then we stopped her exercise and everything, and then she started having a normal development of her breast. Sometimes surgical correction may be needed for aesthetic reasons. Now, juvenile breast hypertrophy. Juvenile vaginal or idiopathic breast hypertrophy is characterized by a massive rapid development of one or both breasts despite normal levels of circulating estrogens. Treatment of juvenile breast hypertrophy includes surgical breast reduction because no medications are acceptable for the use in adolescents. But we have 3 stages of adolescence. It's the early, the mid, and the late. But we have to do the surgical interventions only in the late adolescence. Now, tuberous breast, this is also very common. I have seen many patients with tuberous breast, and they are really bothered about the shape of the breast because it comes, it produces like a tube sort of a thing, and they think that this is an abnormal breast. Tuberous breast deformity is a common congenital condition in which the base of the breast is underdeveloped and the nipple and areola are overdeveloped. We have to do a lot of counseling to these adolescents till they become adults, and then reassess them for tuberous breast. They may need the aesthetic surgery later on. Infections and breast abscess in adolescents. Mastitis and breast abscess are less common in adolescents. Actinomyces can cause mastitis in patient and nipple piercings because in outside world, Western world, we see nipple piercings as well. And common causes of breast infections are superficial injury to breast, obesity, mammary duct ectasia, epidermal cyst, etc. Management is medical with antibiotics or surgery if needed. Mastodynia, breast pain, is one of the most commonly reported symptom. I think that I will skip. Adolescents could have breast pain if they are physically active and have large breasts. I have seen one patient who had very large breasts. She was 17 years old and she came to us with severe back pain. And then we could guess that it is because of her large breasts. We had to do a surgical intervention in that patient, and the patient is now fine. She doesn't have any back pain. It was causing a lot of, shape problem in the spine. So we be very careful when you see the large pain. This is finishing. So breast masses in adolescents, it is very rare, and just one thing I'll tell you, that in adolescents most cases are mostly benign, and all these tumors are very, very rarely seen. It is reported in literature that only 2.5% of masses in women under 30 years of age are malignant, and only 0.5% of masses in women under the age of 20 are malignant. So the take-home messages is that Tanner scale should be used to assess proper breast development in adolescents. Body image issues should be dealt with complete privacy and non-judgmental approach. Surgery should be deferred till full development of breast is reached, and counseling is very, very important. Thank you very much.